Pediatric cancer patients require radiation therapy. In the past, they needed anesthesia to stay still, requiring daily fasting. Children are the heroes against cancer, and we care for these heroes. So here we are, HEROCARE. This groundbreaking project offers tailor-made radiotherapy preparation using immersive technologies for children with cancer, sparing them from anesthesia and also nurture values and ethics in students.
According to the preference of the child, we take up different roles to take care of the children and carers during the workshop. We learn the power of teamwork, which is crucial in healthcare profession.
During the actual workshop, we dive into a child's world, learning to connect with empathy and compassion. By incorporating interactive games and storytelling, we not only break the ice, but also cultivate empathy and trust, ensuring that both children and their parents feel valued and understood throughout their journey in cancer care.
This hands-on involvement is a refreshing change from traditional clinical placement, where we often feel like mere observers. Through the experience, we witness how compassion bridges the gap between fear and hope.
As a teacher, I'm delighted to see how students unleash their creativity with freedom to explore generative AI and immersive technologies.
And our involvement in HEROCARE has been a transformative experience, fostering empathy, social responsibilities for healthcare students through patient-centered care.
By nurturing future healthcare providers, HEROCARE cultivates a community dedicated to compassionate care, ensuring that the roots of social responsibility and empathy run deep in the healthcare system.
HEROCARE for 2 years.